We have talked about everything from the hair on your head and the hair on your chin to your pelvic floor muscles and period flow this season, this first season of Phase to Phase. Navigating your hormones and navigating this healthcare system of ours can be challenging and exhausting. What's even more exhausting is that you're doing that on top of your regular day-to-day burden of responsibility, which is usually quite high. Not only that, you're often not getting answers, you're trying to figure things out on your own, and you're trying to wade through the absolute mountain of well-crafted marketing and grifting BS out in the world trying to feel better. I actually did a whole TEDx talk on this topic. Go check it out. I'll link it in the show notes. I really want us all to feel well and to thrive, to have energy and to have the capacity to do whatever it is that we want, but also what we need. We live in an increasingly fragmented world, and I think we all have a role to play. I believe that developing agency over your health, having your health, is not only a personal act, but also a powerful and political tool for shaping a healthier world. And I think we can all agree we need a healthier world right now. So before I take a little hiatus to bring you season 2 in the fall of 2026, I'm sharing 12 things about your hormones and health that you need to know to feel well. I'm Naturopathic Doctor Anne Hussain, and this is Phase to Phase, the Hormone Health Show, Season 1 finale. Starting something new is often scary, exciting, and riddled with uncertainty. And this process has been no different. It has been a pleasure at the same time. I've had some great conversations with guests, incredible guests who have offered perspective and parts of their own journey of changing their minds when presented with better data. And this is something I really encourage us all to do more and more of, to change our minds or to expand our understanding as we're presented with better, more robust, more compelling data or viewpoints. So I hope if there's anything that you'll take away from Phase to Phase, it is that. I've also had some great solo episodes. I've received some great feedback from many of you on the topics and how well-rounded and validating some of those episodes have been. So I'm really appreciative of anyone who has messaged or commented or told me in person about how the podcast has affected you. Please subscribe and follow, and stay tuned for season 2 in September of 2026. I'm going to keep this episode digestible and bite-sized because I really want to drive in the top 12 lessons from this season that you need to know about your hormonal health. If you want to listen to the full episodes, you know where to find them over at phase2phase.ca. Let's go. Number 1, your lived experience is data, and it's often data that is better than a hormone test would tell us. There is a time and place for hormone testing to rule things in, to rule things out, and sometimes to monitor you or your treatment. However, for the most part, and for most of you, what's most important is the signs and symptoms that you've tracked. Yes, they are based in hormones and hormonal change. However, testing your levels will not help our understanding. It will not change our treatment plan, and it will not often help us monitor progress because we cannot oftentimes draw a straight line from your symptom to a hormone level. And vice versa. We all respond to hormone change a little bit differently. This is why I did my TEDx talk. I'll link it in the show notes, but go listen to it. It's because you have a response to hormone change that's happening, a response that's informed by your genetics, your life circumstances, your stress levels, what else is happening in your health, and so many other factors. If your doctor does not want to run a hormone test, sometimes there's a very real reason why they're not doing it. It's because it doesn't change anything in how we support you. And that's the thing I also want to drive in. We still support you. We still help you out. We still address your hormone-based symptoms that are getting in the way of your life. But the hormone testing might not be necessary. Number 2. Cortisol is not the enemy that it has been made out to be. We have blamed cortisol and given it such a bad rap because it literally is doing its job, which is responding to your day-to-day, moment-to-moment life circumstances and situations. And we have adopted terms like cortisol face, cortisol belly, which are a little bit marketing buzzword, a little bit of just a communication term to relay that we're retaining water or that we have gained weight as a result of a high stress / nervous system dysregulated time. But really, water retention is influenced by so many factors like insulin resistance, if you have some, your sleep, where you are in your menstrual cycle, salt intake, fruit and vegetable intake, exercise levels. All of these things will influence water retention, and that's not cortisol. Some of it could be a result of nervous system dysregulation. For example, if you're super stressed out or when you're feeling low, maybe you're reaching for more alcohol, more salty foods, less fruits and vegetables, more caffeine, not sleeping properly, not seeing the people you like, not going outside as much, right? So all of those things, will they have an impact on how you feel and how you look? The answer is yes. We have conflated all of those things into this reductive term of cortisol face and cortisol belly. There are very real autoimmune cortisol disorders that are out there where I'm not talking about those. I am talking about the colloquial use of the term cortisol or my cortisol is high. There are many people who are using this way of relatability of how we start to feel and look when we're stressed out to sell to you unnecessary products. There was a huge movement of showing before and afters in different lighting, better makeup, before and after weight loss, which yes, your face will look a little different after weight loss and or after you've gone through something big in life. And all of this should be part of this conversation. Cortisol is honestly just doing its job. It goes up and down based on what you do in life. What we actually want to do is improve your capacity and resilience so that you can feel less stressed, feel less tired, retain less water, make different choices in your health. There is a push and pull in recovery and capacity building and resilience. Resilience building oftentimes does not feel resilient. It can actually feel quite uncomfortable. But the only way to improve our resilience and capacity is by taking on harder things slowly and surely and steadily in order to not shrink the bubble that we're living in, but to expand the boundaries of what we can tolerate. That actually comes with rest and recovery, fueling properly, sleeping well, working on stress management, connecting with the people you love, doing the things that you love, having better social infrastructure in place, having better socio-political environment around us. All of these things actually play into our cortisol levels, but cortisol is not the enemy. Number 3, weight loss, weight management is multifactorial and not just about willpower. This is a topic that has been discussed ad nauseum in the online space, especially in the last years with medications like Ozempic, Wegovy, Mounjaro, etc. And the conversations we're having are the same over and over and over again. What our bodies look like are a product of many factors. Just like your hormonal health is multifactorial, just like your endometriosis is multifactorial, just like your PCOS or PMOS is multifactorial. How we carry weight and how we put on or lose weight is influenced by so many different factors, like your genetics, your epigenetics, your upbringing, your family of origin, your mental health, the mental health of the family of origin, or the people that you live with, the marketing that we have been exposed to, patriarchal beauty standards, and I put beauty standards in quotes, your health status, your medical history, your capacity, your healthcare access, your postal code. There are so many factors here. Also, you can look like a lot of different things and be in poor health, and you can look like a lot of the different things and be in excellent health. Just want us to remember that. Number 4, fiber is more important than protein for your longevity. I said what I said. High fiber intake, and remember, high fiber intake also means high amounts of plants, is consistently associated with decreased risk of heart disease, cognitive decline, many different cancers, digestive issues, and better hormonal health, including perimenopausal symptoms, PCOS or PMOS related health changes, endometriosis symptoms, and adenomyosis symptoms. So please eat your plants. Aim for 25 grams per day. Eat a diversity of plants. You get different forms of fiber when you get exposed to different types of plant foods, including vegetables and fruits and nuts and seeds and whole grains and lentils and beans, etc. If your baseline consumption is low, then go slowly, especially if you also have a digestive disorder like IBS or something like that. We don't want to aggravate your symptoms, and we might want to pick fibers that are less fermentable. Don't get me wrong, we do need protein. Most of us do hit the minimum protein requirement, which is 0.8 grams of protein per kilogram of body weight. However, most of us would also benefit from a little bit more protein than that. So the range we use is 1.2 to 1.6 grams of protein per day per kilogram of body weight. Where you fall within that range really depends on your age, what's happening in your health, what's your physical activity like, etc. Number 5, peeing when you sneeze, jump, laugh, cough is common but not normal. Oftentimes, this is pointing to pelvic floor dysfunction. Your pelvic floor is a group of muscles that sits in your pelvis. To those muscles are anchored your urinary bladder, your uterus, and your rectum. There can be tightness in those muscles. There can be lack of coordination in those muscles. There can be laxity in those muscles. And there can also be spasming in those muscles. So there can be lots going on in there, and Kegels are not always the answer. Pelvic floor dysfunction can be associated to urinary symptoms, but also period pain, pain with intercourse, but also issues with your digestive tract and digestive function. This is where a pelvic physiotherapist can be a great addition to your health team. Number 6, the birth control pill is not evil. It does not cause infertility. It can be a great solution for some of your period problems. It is an effective contraceptive, and there is a time and place for it. The birth control pill is a tool. If you're using the combination estrogen plus progestin type of birth control pill, it works by suppressing your ovulation and suppressing your menstrual cycles because we're giving you a constant dose of hormones. So it is effective as a contraceptive if you need that and you don't want to get pregnant. It is really helpful if you're trying to manage heavy bleeding and or period pain or irregular cycles. It can be helpful for PCOS or PMOS symptoms like acne, and also to prevent endometrial hyperplasia, which is overgrowth of the lining when we go too long without a period. It can be helpful for a lot of things. However, it does not tell us what's happening underneath, and that's where it has been demonized because many people put on the birth control pill were never investigated properly, were never assessed properly to see if they had a condition of some kind. And then when they were put on it, it managed or it masked those symptoms that were associated with that underlying condition. It's a tool that has to fit you, but where I think we have in the medical system done wrong by people is by not explaining what it's doing and what might be going on in the background and not assessing properly. And then when people come off the pill, or when they're investigating their fertility, for example, or when someone in their family has been diagnosed with a condition, they now question themselves and feel like they were just put on something that they didn't really consent to in that way. It's a lack of discussion around it that is the problem. Number 7, be careful when you see demonization of food and food groups. Having flexibility in your diet and nutrition, especially in a world that puts so much pressure on our time and energy, is all right. The theme or the pattern that you want to focus on is mostly whole foods, lots of plant foods, lots of nutrient-dense foods, but remembering that not all ultra-processed foods are bad. A protein powder, which is an ultra-processed food, is not the same as a bag of hyper-palatable, sugar-laden, nutrient-stripped gummy bears, although the odd gummy bear is not going to make or break your health, even though we do want to consume less of it. Is there a better way of eating food, of Managing nutrition, the answer is yes. But do we add in dashes of convenience and flexibility in there to make our lives easier? Also, yes. Number 8, there is no safe amount of alcohol when it comes to cancer risk and your overall health. I highly encourage you to listen to the episode on reducing breast cancer risk. We also talk about mammograms in there, but there is no amount of alcohol that is considered safe. Any alcohol consumption increases your risk by a little bit, especially in esophageal cancer, liver cancer, and breast and prostate cancers. On the other hand, I want to bring some light to soy, which is not associated with an increased risk of cancer. Soy has phytoestrogens, which are helpful for your health. Soy is also a great source of lean protein. So don't be afraid of soy and try to avoid alcohol. Alcohol also tends to worsen anxiety, perimenopausal symptoms like hot flashes, and dysregulates your sleep. Number 9, even though perimenopause is defined by changes in your periods, some of the symptoms that start coming up first are changes in mood, changes in sleep. If you don't already track your cycles, track your symptoms, please do that. If there is a relationship of your symptoms and signs to your cycle, we will know. And if there isn't, we will also know. Either which way, going back to our point number 1, your lived experience is data and only you can track it. So please do that. Perimenopause or the menopause transition can take a long time, like many years, like even a decade. And oftentimes patients are dismissed when those changes are starting up because sometimes they do start really subtly and you question yourself, is it because of hormones or is it because of life? Is it because my parents are ill and I'm taking care of them? Is it because my kids are now at a different age? Is it because my workplace is changing? Is it because the world is changing? Oftentimes, all of those things are happening all at once. People are also having iron deficiency or vitamin D deficiency, which can sort of change your baseline experience. You deserve care. A lot of patients are denied hormone therapy, even if they have hot flashes and perimenopause. They are told that you're too young to be in perimenopause, which is not true. If you're in your late 30s, early 40s, it is very possible. And then some people also reach menopause early, in which case we do really want to make sure we replace hormones for you because it improves your longevity. It decreases the risk of osteoporosis, heart disease, and cognitive decline. So if you think you're in perimenopause or if you're having hormone changes, please talk to your medical team and please track your symptoms. Number 10, there is a range in what a healthy and normal menstrual cycle looks like that will change based on age, who you are, and a lot of your other medical and non-medical factors. Too often do we normalize heavy menstrual bleeding and symptoms like period pain. Severe period pain is never normal. The most common culprits tend to be fibroids, endometriosis. A normal cycle length is between 24 and 38 days. There can be some changes if you're in perimenopause, postpartum, for example. If you are early on in your menstruating life, like you've recently started having a period, your period should be no longer than 8 days, and the amount of blood lost is around 5 to 80 milliliters, although the average is around 50. If you're noticing large clots consistently, if you're noticing intermenstrual bleeding, so spotting between cycles, if you're having debilitating pain, all of those things are not normal. Flooding through your period products, if you're changing your period product like every hour, that is not normal. Please seek out some care. There are some options for you. Number 11, if you have a hormone-based condition like PCOS, which is now PMOS, or endometriosis, it's not just about reproductive function. It is actually about your whole body and your whole life, because these conditions have been shown to increase the risk of other health conditions, including heart disease down the line. The name of PCOS, or polycystic ovary syndrome, was recently changed to polyendocrine metabolic ovarian syndrome, or PMOS, because it is a metabolic condition that affects your reproductive system. It is a lifelong condition that affects multiple systems in your body. It's not just about your ovaries. You don't even have to have polycystic ovaries in order to have PMOS, which was formerly PCOS, and that's what the name reduced it to. There are links to longer term and down the road health conditions that are beyond your fertility and reproductive system. So please remember, you do deserve care and solid management strategies that improve your quality of life. And finally, you cannot biohack or out-supplement a poor foundation. I'm going to first start with the individual component, and then I'm going to end off this episode with the systemic component. There are lots of tools out there that you can use to improve your health, but the foundations will always apply, especially when it comes to your overall health, your long-term health, nutrition, eating enough for your body, physical activity regularly, and having a diversity in there as much as possible, managing your stress, getting good sleep, getting your screening tests and checking for your metabolic health, like blood pressure, for example, social connection and community. All of these things are the foundations that your health is built upon, and those are always going to matter. You'll always see more ads for a supplement or medication, which have a time and place, especially if you're managing a condition of some kind, or if you have a diagnosed health problem of some kind, or if you have a deficiency of some kind. Those things have a role in your health and wellness plan. However, the foundations will always apply, and those are, for the most part, not something that can be sold to you. They're something that you put one foot in front of the other to do. And now I'm going to move on to some of the systemic pieces by getting political, because I know no other way to be. I want a better world for all of us and for future generations. So I'll leave you with this. You cannot biohack your way out of a broken system or a dying planet. So much of our health, so much of your health is dependent on your postal code, where you live, who you're surrounded by, and the policies of these places. Policies that are choices that are being made and influenced increasingly by a smaller percentage of people who hold a lot of money and power. And it is our duty and responsibility to hold them accountable. The wealth inequality over the last 6 years has increased astronomically. We are giving more and more of our tax dollars, the dollars that are supposed to serve us and our communities, to private companies. Real health is giving a damn about your body and the people around you, but also the world your body lives in. We live in an increasingly fragmented time, and there are huge gaps that are turning into chasms when we look at systemic inequalities. We have to remember that affordable housing is healthcare, livable wages is healthcare, climate protection is healthcare, food security is healthcare, protecting our biodiversity is healthcare. And we are unfortunately in the midst of attacks on all of those things, which seems daunting, but we can actually pull on the thread of any or all of those things, whichever one speaks to you, and start making a change. It actually requires a very small percentage of us mobilizing to move forward change. These are policy choices that we can influence. And this is part of the reason why I want us all to feel well. I don't want to put more on your plate, but this is being part of a community. We live in an era of hyper independence and convenience, but the way forward requires interdependence. Real health requires community. It requires us taking care of each other, even when it is inconvenient. And I'll be honest with you, taking care of each other can be really inconvenient. You have to go out of your way. You have to sacrifice some of your resources and time. I don't want to be the one to ask you to do more under the weight of patriarchy and systemic discrimination. But if we won't, then who will? Health real change requires collective action, requires voting with your dollars by rejecting grifters. It requires leaving behind consumerism and these random social constructs like beauty ideals that we have. It requires actively supporting local, small, and marginalized communities. It requires accountability and pushing for accountability in politics. So write to your MPs, write to your MPPs, call your local representatives wherever you are, support community organizations, like, share, and comment, but also pair it with some other action in the real world. Go to protests, go to rallies. The fabric of inequality and oppression is wide. Pull on whichever thread that speaks to you, that is dear and near to your heart. But at the same time, please take care of yourself. And maybe one needs to come before the other. Maybe you need to take care of yourself first so that you have the capacity to do the rest. It is worth it. I really believe that self-advocacy in a broken system is a heroic act of feminism. And I'm going to ask you to do that. I started this podcast and I wrote my book, The Period Literacy Handbook, because I wanted to talk about the sociopolitical landscape of the world that is oftentimes missing from conversations on health and hormonal health especially. Everything is political. And I'm going to continue to talk about it. Yes, I live in the private healthcare space, which allows me time with patients, but I love our public healthcare system. I want everyone to get dignified, respectful, patient-centered care. That's it for now. Make sure to follow and subscribe. Make sure to listen to any episodes that you missed or watch on YouTube and share them with the people in your lives. I hope you rest. I hope you cultivate joy. I hope you focus on your foundations. And I hope we all take care of one another. Thank you for trusting me, for listening with curiosity, and for stepping into your own agency. Remember, you deserve to feel well. I'm Naturopathic Doctor Anne Hussain, and this has been Phase to Phase, the Hormone Health Show. I will see you in a few months for season 2. We've got a great lineup of topics. If you have any in mind, send me a DM on Instagram or LinkedIn or over at phase2phase.ca.